Dr. Katie from ScribeNote, and we are here on the next episode of What's Up Doc. Today I have Dr. Cassandra Fleming with us. You may recognize her. She is a pretty popular face on the Vetfolio podcast. So welcome, Cassie.
Thank you. Thank you so much. I'm Cassie Fleming. I'm a 2014 graduate from the University of Florida, and I'm a triple gator. I have my bachelor's, master's, and DVM from the University of Florida. Went to school pretty much my whole vet school career, assuming that I was going to work on food animals and just work in production medicine, particularly dairy cows. I love dairy cows. That's where all my externship time was. And then I got out of school and I started doing small animal medicine. It was at the tail end of the Great Recession, and so jobs weren't as bad as they had been, but they were still a little bit hard to come by. So I took this job out of school, and yeah, ever since I've been doing small animal general practice, and then I started working for Vetfolio back in 2019, and I had no idea what I was getting into. But somehow, found myself hosting a podcast and these different continuing education things and getting to interview really cool people like you, Katie. And so, yeah, I've been doing that since 2019. And like I said, I still do some relief work, and then I own a house call practice on top of that. So it's constant craziness, but I keep that practice pretty small and pretty tight-knit clientele there.
You certainly have like your finger on the pulse of like what is happening in the profession. Well, at least, the social aspect of it. Any like new things that have come up that like have really surprised you?
Gosh, there's so much. I feel like I say this on the podcast a lot of like what a time to be a veterinarian. There's so many things that are changing and developing and that we have access to that we just didn't before. I mean, gosh, it's from like different medications, there's conditions that have been kind of a snooze fest, talking about diabetes and kidney disease and just not having a lot of options. And now that has completely changed. Now management of those diseases looks very different than it did in the past. That kind of stuff is really exciting. I think it was just yesterday I was talking to Dr. Lila Proenzo with Vet Ahead, and her resource for exotic animal medicine, which I mean, thinking about that in terms of just the resources that we have at our fingertips and that we can use. And then of course, eventually I always love to circle back around to the human aspect of veterinary medicine, which sounds a little weird, the human aspect of veterinary medicine. But, there's talking about ways of continuing to create sustainability in the career and help uplift everybody in the profession. And yeah, I think that conversation is constantly evolving and really, really interesting.
For sure. I think there's a lot more resources than there used to be, and I think a lot more openness too about the struggles in the profession because it's so complex, right? You are incredibly busy. You own your own house call practice. You are a mom. You are a big Vetfolio podcast star. And so, how do you do it all?
Well, it sounds way cooler when you say it, like when, living it. I don't know that it feels quite that cool. To be honest with you, it's one day to the next. It's constant madness and trying to keep the plate spinning. And if I'm being completely candid, that's not always a positive thing of that constant busyness and running from one thing to the next, trying to keep it all from falling apart. I think that there's something to be said for slowing down and for being able to take a breath and take a break. And that's something that I'm trying to work towards and figure out what that looks like for me. So I always want to stay away from that busyness and working and running all the time from being a pride point, because I think it's important to stop and smell the roses and to have some downtime as well.
Setting boundaries, I think, is like such a hard thing to learn. Maybe let's talk a bit about how you got into Vetfolio. So interesting.
So I've been involved with NAVC for quite a long time, dating back to like the days when it was the North American Veterinary Conference, not the North American Veterinary Community, and it truly was just a conference, and it was at the hotel, the Marriott, and the Gaylord, and so have been attending. My husband did the signs for, when we didn't have the digital signs, it was these big cardboard signs. He was the one that would like change them all out in between sessions so people knew where to go. And that kind of carried on up through vet school. And then in vet school, I was the student rep for NAVC because the conference and the North American veterinary community is so near and dear to my heart. So there was some previous level of connection with the organization. But I graduated and I went out into practice and I was doing my thing. And a friend of mine who worked for the company, called me and said, "Hey, we want a veterinarian's perspective in a more hands-on way on some of the stuff that we're making. So we know that we're creating content that's really needed. And so would you consider coming in and doing this?" And my first reaction was no, absolutely not. I said, that sounds like a lot. I don't really want to put myself out there in that way. I'm kind of happy where I'm at, but she's very good at talking me into things, and somehow they become my idea. And so that happened here. Despite initially saying no, all of a sudden, I was in this hotel lobby giving an elevator pitch about why I was the perfect person for this job when really, like, I had no idea what the job actually was. That's been such a cool journey because it's evolved over the last 6 years. And I can't wait to see what the future holds for it. It's such an amazing team to work with. It's a really small team. This is not like a giant conglomerate full of people doing all these things. It's just really, really good people who are passionate about what they're doing, who are good at what they do. Just to see the evolution over the last 6 years, and then I'm so excited for what we're going to see in the future with it. It's such a privilege to be able to have these conversations and then put them out there for other people to listen to. I mean, I like I said, I feel very blessed. I feel very fortunate to be able to do that. And it's opened my eyes up so much to just our industry in general. I'm sure you've probably had a similar experience of just how open, how kind, how willing to help so many people in our profession are.
I didn't really know the part, you said to us when you introduced yourself about you mostly being interested in large animal medicine prior to starting in practice. That must have been a really big change.
It was. So I had, prior to going to vet school, I had worked in anesthesia and the ICU at the University of Florida. In small animal primarily. I did some large animal when I was in the anesthesia department. But my coursework in undergrad and some of my volunteer experience and stuff like that was more heavily food animal. So I had experience certainly on the small animal side of things. I wasn't completely green when it came to working in small animal medicine. But yeah, I don't know. I love Holstein cows. I feel like they're just like the Labradors of the food animal world. And I have to stand on a block when I palpate cows because the Holsteins are so big and I'm very short. But I had some really amazing mentors. So I was actually pretty good at checking cows and pretty consistent with it. And I love so many aspects of working. I love goats. Oh my gosh, like goats are the funniest animals on the face of the planet. Fun fact, I'm terrified of pigs. Pigs are a hard no from me. but but goats and dairy cows in particular, and certainly I love, beef cattle too. I just it's such a they're such neat animals to work with. And I think there's definitely a part of me that misses it, but I've really enjoyed my time in small animal, and I'm still enjoying it. And there's so much to learn. There's so much to do. The human animal bond looks different on the small animal side compared to the production side. And I don't want to take away from the production side. I think it's there to a degree on the production side too. It's just different. So, I mean, I guess for myself, for the future, I foresee staying on the small animal side of things, but I will always have such a special place in my heart for production animal medicine, in particular dairy cows. Oh my goodness.
Yeah, I worked on a dairy farm before, like one of my friends from high school, her dad had a dairy farm. I like milk. I worked on a dairy farm before, like one of my friends from high school, her dad had a dairy farm. I like milked cows and fed calves and really loved the cows. But never really had the drive to, be up in the middle of the night in a snowstorm doing surgery. Like
Yes.
huge kudos to large animal veterinarians. Like they are badass. Like
Yes, you are not kidding. It takes a special person to do that, and especially to do it, in the long term. My gosh, like, yeah, exactly. Kudos to everybody working in that section of medicine.
have you ever thought about adding in like, backyard pets and into your house call practice? Like,
Yes, I definitely have, and it's purely from the standpoint of just missing the time that I was able to spend, particularly with goats. I love goats. They're the funniest animals. Uh, I haven't done it to this point because I have been kind of removed from that section of medicine. So there would definitely be a learning curve for me to just kind of remember some of the things that I'm doing. And it's been a time thing is has primarily kept me from venturing back into that side of medicine. But maybe as I continue my journey towards this balance or integration or whatever it ends up looking like, there will be an opportunity to spend a little bit more time in that arena. The possibilities are endless. They certainly don't end with your small animal, your large animal, your food animal, your exotic, one of those. Yeah, and Katie, I think that you're the perfect example of because you still practice, right, part of the time, and then, working on the technology side of things that is supporting so many veterinarians in practice. And I think there's a lot of opportunity to get creative. I think you have to be brave, and I think you have to say yes and kind of put yourself out there a little bit. But if you're willing to do that, I love that about this field, that the possibilities just go on and on and on.
yeah, you're right. Like so many different opportunities, which I think people don't need to feel stuck,
Mhm.
if there's not like a fit that's good or like a toxic workplace, like there's so many different opportunities you can put yourself out there for, I think.
There's so many opportunities outside of working in clinical medicine, and I think I've struggled with this and had to learn this a little bit myself, kind of trusting your knowledge that you don't have to be a specialist, you don't have to have extensive knowledge on one particular thing or on everything. You're a DVM or whatever role you have in this field. Trust your knowledge. You do have expertise. Even if your expertise looks different from someone else's, that doesn't make it less important or less relevant. So trust yourself and what you know and what you've learned, and that you do have valuable input to bring within the profession, and that can be anywhere. It doesn't have to be in the clinic.
Yeah, for sure. It's so recently going through that kind of change from full time in clinic to some time in clinic and then some time with the company. It's strange saying out loud that like I was enjoying myself outside of the clinic. I think like it's this like imposter syndrome. Like if I'm not in the clinic, I'm not a real vet, right? Like I think, you work, if you've decided you want to be a vet for a long time and you work towards it your whole career, it's like this a picture of what a vet is. And it's like in the clinic touching animals. And it's
Yes.
true. Like it's so much more, I think.
I couldn't agree more. So initially when I started working for Vetfolio, I was working 1 day a week and the rest of the time I was in practice. And then as time went on, I went up to 2 days a week, and that was going to take me out of practice much more than it ever had in the past. And yeah, I actually reached out to Andy Rourke, and he was just absolutely wonderful and so kind. And I asked him, I was like, I'm really struggling because I don't feel like I'm a real vet if I'm not in the clinic touching animals all the time. And I want to talk to somebody who is more on the industry side. And of course, he still practices too. Um, but, how do you balance being I'm using industry very loosely, but, the industry side versus the clinical side, and still reconciling like being a real vet and feeling like a real vet. And yeah, so I can relate to those, and those conversations are so important because yes, 100%. I can look at you and say, of course you're a real vet and you're helping so many people, because goodness knows I use Scribe Note constantly. But those feelings are real, and it's hard to reconcile them. Even if you can look at someone else and say, of course you're a real vet, it's hard to reconcile that inside yourself sometimes.
With regards to your house call practice, do you have anybody you take out with you? Do you go on your own? Like, what is you said you keep it small. Obviously, that makes a lot of sense based on the fact that you're so busy. Tell me a bit about kind of how you run the show there.
Yeah, so this is another thing that, if you're kind of like, oh, I think I want to start a practice, house call is not a bad way to go, because you can kind of start small and scale up depending on what your specific needs are. My practice was born out of COVID, and I, found myself out of a job. That's a longer story, but trying to figure out what I was going to do next because I've lived in this area for quite a long time. So friends and family, I had a lot of them going like, "Hey, we still want you to be our vet. What do we do?" And initially, like, wonderful people that they were following me around to like relief jobs, and eventually I was like, this doesn't make sense. So I started this house call practice, which, oh my gosh, you want to talk about imposter syndrome? I'm like, what? Who the heck am I thinking that I can do this? I worked through it as systematically as I could, but at some point just had to go for it and say, all right, let's see. And it's mostly just me. I occasionally, if I have a pet that's really hard to handle, or I have to do something that's maybe a little riskier, if I have to do a sedation, or I have one pet who had a really severe vaccine reaction. I think it was like the number of vaccines that he got, and if we space them out and do one at a time, he seems to be okay. But still, when I go give him a vaccine, I bring somebody with me. And, usually just being in the area for a long time, I'll call somebody who, I've worked with at one point or another and say, hey, are you free? Will you go see this house call or this day of house calls with me? But mostly it's just me, myself, and I that go out. And that means patient selection is really important, making sure that I've certainly had animals where I just have said, this pet is not a candidate for this kind of house call. They're too stressed. This is one of those pets that actually is going to do better in the clinic, and they do. And also like a lot of Gabatraz, which I think is true in the clinic too. But leaning into those anxiety meds, I've gotten. I, sedation for house calls is still not my favorite, especially, I try not to do it if it's just me, but in cases where it's needed, certainly doing that. It's kind of a neat thing when you do it on your own. And I think there's a lot of advantages to having a technician that rides with you, or a CSR that handles your phone. There's some really amazing like virtual CSR options. But when you do it just yourself, at least the hands-on part, you develop this really cool relationship with the animals who are feel okay enough to let you poke them with needles and stick things in their ears and all this kind of stuff. And also from the business side, it's trial by fire. You learn so much. So if I just got an email from my accountant that said, hey, we can't process payroll anymore, so we're going to need you to find another option to do the payroll part of this. So the last 2 days, I've been down this like deep, dark payroll tunnel trying to figure out how in the heck to process all these things I never wanted to know. But it's you learn a lot really quickly, and you learn how much you're capable of. And so, along the lines of imposter syndrome and things like that, I would say if you are considering it and it's that fear, that insecurity, that imposter syndrome holding you back, you can, if I can do it, you can do it.
Any courses that you took or anything like that that you could share, we could link in the notes under the chat that you could share with people who might be considering starting.
Gosh, that's a good question. It was such a jumble when I did it. I will say there's some really good courses, like Vetfolio wise, of course, I want to make sure and bring that up. There's one about I think it's from the Open Door Collective, and they talk about financial triage in your practice, and they talk about inventory management and things like that. Certified veterinary business leader, you can learn some things there. But yeah, those are some good resources. I'll also say I'm part of the Uncharted community, and they have a ton of really good business resources and a lot of great support there. And really, like having a good team of people on your side, I think is important. So talking to a lawyer, like I talked to Lance Rosa when I started mine, and he made me feel much better about what I needed to keep in mind and kind of like the deal breakers versus where I could learn along the way. I can't recommend strongly enough having a good accountant because that is one area that I I understand way more than I ever did, but you just need somebody to kind of help walk you through that no matter what phase you're at. Yeah, talk to people around you who have opened businesses. And I think what you'll find, at least this is what I've found, is most of us are making it up as we go along. It's I think I was listening to a Dave Nichol podcast, and he was talking to Matt Saloy, the economist who he used to be with ABMA. I think he's with BMG now, and somebody else, and they were talking about if you're a business owner and you need straight A's all the time, you're probably really going to struggle. But if you're okay with a C plus, then you're doing okay. And I think that's what you'll find with a lot of businesses is we're doing the best we can with the information that we have, and making adjustments along the way. So, not having to have it be if it's not perfect and you don't understand everything, reach out to the people around you. Most people are willing to help. And even if you can just get it to like the good enough level for now, that's okay.
Yeah. Yeah, I think lowering your expectations, like when you're taking on a new venture and just, again, like giving yourself some like wiggle room and some grace when it comes to starting something new, I think is always really good.
And then I was also thinking about it when you asked about resources. If you're thinking about starting a house call practice, House Call Vet Academy is fantastic. And I'm a big fan of eMyth. eMyth I wasn't ready for when I first started my business. Like I don't think I could wrap my head around the concepts when I first started it, but now 5 years in, I read it again and went, oh, now it makes sense. So those are two other really good resources out there.
Before we sign off, is there anything else, that's been like a hot topic that you think we should touch on at all before we go?
Gosh, that's a good question. There's
Super,
there's
super
so many
vague.
things. Yes, no, I love it though. It's a good way to ask a question. Gets my wheels turning. Well, first of all, I'll say thank you so much for having me. This has been really fun. I get as much as I talk on podcasts, I get really nervous when the microphone gets turned back to me because I'm like, no, I ask the questions. I don't answer the questions. But you have made this really fun, really comfortable, and I've enjoyed it quite a lot. Hot topics. Yeah, gosh, there's so many. I think maybe more so just a take home point of, vet med is a team sport. Don't go it alone. And there's so many people out there who are ready and willing and happy to help with whatever unique challenge you're being presented with. So don't be afraid to reach out to the people around you and because it is challenging. It's challenging being in this profession. Life is challenging in different ways. So but yeah, as evidenced by so many people that I get to talk to on a regular basis, it's an amazing profession full of wonderful people who really want the best for other people around them. So make sure and reach out and don't struggle on your own.
I agree. I 100% agree. I think that's a perfect place to say goodbye, and we will see everyone next time on What's Up, Doc. Thank you so much, Dr. Cassie, for joining us. You are so incredibly busy, and I feel honored that you took the time to join us on our very new podcast. So thank you again.
Oh my gosh, Katie, this has been so much fun. The feeling is mutual. I was so excited when you reached out and asked me.
Awesome. Okay, well, we'll see everybody next time.